ACLF, acute-on-chronic liver failure, is a severe, serious critical illness. And it's an illness that we see in people who have underlying chronic liver disease, usually from cirrhosis.
And it's a devastating disease in the rapidity of how quickly people deteriorate and become sick.
ACLF is the development of liver failure in an acute phase on a patient that already has a chronic liver disease.
Patients with acute-on-chronic liver failure are patients who have some form of advanced chronic liver disease and frequently cirrhosis.
A particular condition when a stable decompensated cirrhotic patient gets an acute insult and therefore becomes unstable.
ACLF is very severe conditions in patients with liver cirrhosis. It is characterized by organ failure after an acute decompensating event.
ACLF is the most severe form of acutely decompensated cirrhosis, characterized by the presence of one or more organ system failure among 6 major organ systems.
Most of these patients are already known with some chronic liver problems, although not always knowing how severe it is. And then there is some triggering event. It can be an infection, it can be bleeding, but quite suddenly their situation deteriorates and liver function declines.
What happens with ACLF is that something happens to the body that actually is sort of like the last straw, and actually the liver that's been coping all the way along suddenly just sort of falls apart and just causes the liver to really stop functioning as it should.
Indeed, there are several precipitants which can precipitate ACLF, especially bacterial infections, alcoholic hepatitis, and bleeding are the ones who account for almost 98% of all precipitants that can be identified. Since when the ACLF is once present, then we have an ongoing organ failure which is very, very difficult to reverse that. The precipitating events are very important because they lead to the organ failure.
ACLF can be precipitated by bacterial infection, GI hemorrhage less often, and alcohol-related hepatitis. Approximately 40% of the patients have only one precipitant, 25% at least 2 precipitants.
They present after some sort of precipitating event, be it an infection or a variceal hemorrhage or systemic inflammation that then mediates extrahepatic organ failures that then cause extremely high degrees of short-term mortality.
And unstable decompensated cirrhotic patients have got a trigger, but the organs are continuing to function. ACLF is when the patient gets a trigger, but then you have other organs that start to fail. And the organs that can fail can be the brain, the kidneys, clotting cascade, and cardiovascular stability and lung function.
ACLF has an extrahepatic component, which means that not only the liver fails, but also you have renal, circulatory, lung, brain failure, and also you can include intestine failure because they have gut translocation, and also they can have an important immune dysfunction.
The problem is also that because these people suddenly they get sick very quickly, and it's like being hit by a car or a train. They suddenly go from being really quite normal to being really incredibly sick. In a matter of hours or within a couple of days, they can go from being at work to literally being in the intensive care unit.
They do a quite rapid acute deterioration of their physical condition, which can then be quite dangerous on the short term because they can very rapidly decline, and all those organ functions are potentially follow in terms of deteriorating. And so these patients are really at a high risk of even more severe disease and of dying.
So at this point in time, we have no approved medical or device-based therapies for patients with acute-on-chronic liver failure. And so the only option that we have for patients who are sick is liver transplant. The problem with ACLF is the severe degrees of inflammation, the multi-system organ failure that drives this short-term mortality. And in fact, patients may become too sick for liver transplant too fast.
There are no treatments who are really assigned for ACLF that can help us, except for liver transplantation. And liver transplantation can be used only in very, very small number of patients with ACLF. So it's not really an option for all the other patients. So there is a huge unmet need in a patient population which is very vulnerable with a very high mortality.
It's really an acute event, and with all the instruments that we have in critical care medicine can revert the situation and bring them back in a more stable situation. But sometimes the evolution is so rapid that even with all the modern tools we have, we are not able to rescue these patients.
So the major unmet need is to improve the outcome of this condition, to improve the patient's survival. And this is a terribly serious illness, and many people with this illness currently sadly die. We have a very limited range of treatments that we can offer for these patients, and effectively in intensive care, when we bring them to the ICU, we will give them organ support to address the organs that are involved, and we will seek to identify what the precipitant to the illness has been, and we will try and address that. But sadly, with many people, by the time we meet them in the ICU, they're already too sick for us to see much improvement, at least with the tools we currently have available to us.
Unfortunately, this is a condition that has a significant mortality, and many patients who are admitted to the hospital with ACLF will unfortunately not leave the hospital.
People are dying every day of acute on chronic liver failure, and it affects their families, it affects the caregivers. We need help to help the patients and to also encourage enthusiasm for our caregivers to continue to support this unique patient population.